Are you or a loved one facing recurrent low-grade bladder cancer? Navigating treatment options can be complex. This video provides essential information about Zusduri, a medication used for a specific type of bladder cancer. Zusduri is a prescription medication used to treat recurrent low-grade intermediate-risk non-muscle invasive bladder cancer, LGIR-NMIBC. This is a type of bladder cancer that has returned after initial treatment. It is specifically for adults who have previously had surgery to remove the tumor, but the cancer has come back or the prior treatment is no longer effective. Zusduri is delivered directly into the bladder. Zusduri contains the active ingredient mitomycin. Mitomycin is a type of chemotherapy drug. It belongs to a class of medicines called alkylating agents. The drug works by interfering with the cancer cell's ability to grow and divide. It does this by damaging their DNA. This action helps to kill the remaining cancer cells in the bladder. By placing Zusduri directly into the bladder, the treatment targets the cancer locally. This approach aims to maximize the effect on cancer cells while minimizing exposure to the rest of the body. This local delivery helps reduce the potential for systemic side effects. It focuses the drug's power where it is needed most, within the bladder itself. Zusduri is indicated for adults with recurrent LGIR-NMIBC. This means the cancer is low-grade, has an intermediate risk of progression, and has not grown into the bladder muscle. Patients considered for Zusduri have typically undergone prior surgery to remove bladder tumors. Their cancer has returned despite these previous efforts. Your healthcare provider will determine if Zusduri is an appropriate treatment option for your specific situation. They will consider your medical history and the characteristics of your cancer. Zusduri is administered directly into your bladder. This is done by a healthcare professional using a thin, flexible tube called a urinary catheter. The treatment is given once a week. You will receive a total of 6 weekly doses. Each dose is instilled into the bladder through the catheter. It is very important to attend all scheduled appointments to receive the full course of 6 doses. Missing doses could affect the treatment's effectiveness. If you need to miss an appointment, contact your healthcare provider immediately. They will help you reschedule to ensure you complete the treatment plan as intended. Before starting Zusduri treatment, it is crucial to discuss your complete medical history with your healthcare provider. Tell them about all your health conditions. Specifically, inform your doctor if you have any kidney problems. Kidney function can be important when considering cancer treatments. You must also tell your healthcare provider about any allergies you have. Do not receive Zusduri if you are allergic to mitomycin or any other ingredients in the Zusduri solution. A critical consideration is the integrity of your bladder wall. Zusduri should not be given if you have a hole or tear, perforation in your bladder. Your healthcare provider will evaluate your bladder before administering Zusduri. This is to ensure the bladder lining is intact and there is no perforation. Receiving Zusduri with a perforated bladder could allow the drug to spread throughout your body. This could lead to serious body-wide exposure to mitomycin. Like all medications, Zusduri can cause side effects, some of which can be serious. It is important to be aware of these potential risks. One serious risk is related to a perforated bladder, as mentioned earlier. If the bladder lining is compromised, Zusduri can enter the bloodstream and cause systemic toxicity. Your healthcare provider will carefully assess your bladder before each installation. This helps minimize the risk of systemic exposure. Another serious warning concerns potential harm to an unborn baby. Zusduri can cause fetal harm if administered during pregnancy. If you are pregnant or plan to become pregnant, you must discuss this with your healthcare provider. They will explain the potential risks to the fetus. Allergic reactions are also a serious concern. Do not receive Zusduri if you have a known allergy to mitomycin or any components of the Zusduri solution. While serious side effects are possible, some side effects are more commonly reported with Zusduri. These are typically related to the bladder or blood counts. Common side effects include changes in blood test results. You might see increased blood creatinine or potassium levels. Changes in blood cell counts are also common. This can include decreased red blood cell counts, anemia, or increases or decreases in certain white blood cell counts. Issues related to urination are frequently reported. This can include trouble with urination, or discomfort. Urinary tract infections (UTIs) are another common side effect. Symptoms of a UTI may include pain or burning during urination, frequent urge to urinate, or cloudy urine. Blood in your urine is also a possible common side effect. This should always be reported to your healthcare provider. Increased levels in certain blood-liver tests have also been observed. Your doctor will monitor your blood work throughout treatment. Zusduri poses risks during pregnancy. It can cause harm to a developing fetus. Therefore, pregnancy should be avoided during treatment. If you are a female who can become pregnant, your healthcare provider will likely perform a pregnancy test before starting Zusduri. This is to confirm you are not pregnant. Effective birth control contraception must be used during treatment with Zusduri. This is required for the entire treatment period and for 6 months after your last dose. Discuss appropriate birth control options with your healthcare provider. They can help you choose a method that is right for you. For males being treated with Zusduri, if your female partner can become pregnant, you must also use effective birth control. This is required during treatment and for 3 months after your last dose. It is not known if Zusduri passes into breast milk. Due to the potential for harm to a nursing infant, breastfeeding is not recommended during treatment. Do not breastfeed while receiving Zusduri. You should also avoid breastfeeding for at least 1 week after your final dose. After receiving a dose of Zusduri, you may notice a change in the color of your urine. It might appear yellow, violet, or blue. This is expected and temporary. It is important to avoid contact between your skin and urine for at least 24 hours after treatment. Mitomycin can be irritating to the skin. When using the toilet, both males and females should sit down. This helps minimize splashing and potential skin contact with urine. Flush the toilet several times after each use to ensure the urine is cleared away. This helps protect others in your household. After using the bathroom, wash your hands thoroughly with soap and water. Also, wash your inner thighs and genital area well with soap and water. Any clothing that comes into contact with urine should be washed immediately. Wash these items separately from other laundry to prevent contamination. Taking these precautions helps protect your skin and prevents potential exposure to others. It is important to inform your healthcare provider about all the medications you are currently taking. This includes prescription drugs, over-the-counter medicines, vitamins, and herbal supplements. Some medications can interact with Zusduri. These interactions could potentially affect how Zusduri works or increase the risk of side effects. Keep an updated list of all your medications. Share this list with your doctor and pharmacist whenever you receive a new prescription or treatment.